for June. And I can't say with confidence. I think April, the next couple of weeks, is going to be our toughest period. May, I hope, please God, assuming folks stay home, will be a little bit better. I can't predict with certainty into the summer. So my rationale is the same. I just got to make sure that I'm being straight with people about the timing and, frankly, what we don't know yet.
But the standard that we're not going to have these large gatherings, including, as you said, religious services or NFL games, which you have in your state, until we're basically at zero new infections, that's not a standard that we apply to any other infectious diseases, including diseases that kill, you know, as many people as this is projected to kill. So why the different standard in this case?
Yeah, I wouldn't say it's a different standard, and maybe it's the way I said it today, but here is the reality. You get that economic recovery, that responsible reopening after you've cracked the back of this. I don't think any of us can expect that we can get this to zero, particularly in the absence of a vaccine, and it sounds like that's a year and a half away. But I do think, and I did say this today, and we believe this strongly, that we need a much broader testing regime. And that will give us confidence if we can quickly test folks. Rutgers University, our state university, by the way, started this week with this saliva test, which they think could be scaled up dramatically. That would give us an enormous amount of confidence to be able to say, you know what, we could get back on our feet again, and we can highlight where there might be a burgeoning hotspot, have contact tracing in place, and keep a lid on this, and at the same time, let us get back on our feet.
That'll be hugely important, I think, for every state. Once you get large randomized tests in the state of New Jersey, what do you expect the death rate will turn out to be from this disease?
Boy, I don't know, Tucker. Based on everything we've seen, it is meaningfully higher than the year in and year out influenza. Of course, influenza, there are vaccines for that. I get a flu shot every year, and please God, we have a shot soon for this as well. I don't have a specific answer other than it appears to be higher. And part of the reason is we know the folks who have passed, and there have been far too many in our state, over 3,000 blessed souls, as you said. The denominator is the tough thing to get our arms around right now, and that's in the absence of the universal testing that we desperately need.
That's right. So you just compared it to the annual influenza. So there is a vaccine typically for that. The new IHME numbers, University of Washington model that I think most of our leaders have been referring to, suggests about 60,000 deaths nationwide by August 4th. That would be fewer than what the annual influenza caused a couple of years ago with a vaccine. So does that shake your faith at all in the utility of a vaccine for this disease? Maybe it's not the final answer.
Yeah, it doesn't shake my faith in either the vaccine, which all experts think is at least a year and a half away. It does tell me that if the death tolls are around the numbers that you've just referred to, Tucker, that all of the actions we're taking are making a difference. I really believe that with all my heart. The fact that we're staying at home, staying away from each other, is flattening the curve, is leading eventually. We've got too many lost souls. Believe me, every one of them is a precious life. But the fact that it may be lower than we had expected means that it's working.
Let me ask you about the specific measures you just referred to. Now, large gatherings are banned. But liquor stores are deemed an essential service. Why, on the basis of what scientific evidence did you decide that?
Couple of things. One is there are liquor stores in our state that actually have a little bit too many backroom gatherings. So we had a little bit of a challenge. We had to remind folks that liquor stores may be open, but to your point, gatherings are not allowed. We relied on a whole lot of reasonable input from recovery coaches, addiction coaches, and they cautioned us if we were to shutter those stores down, we'd have unintended mental health and addiction prices to pay, unintended consequences. And so far, that's the route we've taken, and my guess is we'll continue to take that route.
So, but you have closed church services and synagogue services and arrested people for attempting to attend them. Did anyone say that maybe practicing your faith might be important to someone's mental health?
Listen, I think we've had a very good common ground with faith leaders of literally every faith who understand this. And by the way, whether it's a liquor store, a pharmacy, a supermarket, we expect folks to distance themselves from each other, to wear face coverings, etc. There's an enormous amount of faith going on virtually right now, a lot of practicing going on, and we care deeply about both physical health and mental health.
Of course, but I just, and I don't want to be too persistent on this, but I think it's important. On what scientific basis did you decide that sitting in a church was much more dangerous than buying liquor in a liquor store? And why is buying liquor more important for the social fabric? I'm just trying to think. You're not the only governor who's done this, and I don't mean to pick on you, but I don't understand the reasoning. I don't want to think it had anything to do with tax revenues.
No, it does not have anything to do with tax revenues. Our revenues are so blown up, that would be a rounding error, trust me. This is not either or. It can be and both. I've spoken to Cardinal Tobin, to the leaders of the Jewish community, of the Muslim community. People are at peace where we have come out there. No one's happy. Everyone wants to get back to what they think of as the norm, and who could blame them? I want to do that as well. But I don't think these are one versus the other. I think you could have both of these realities at the same time, and that's what we have in New Jersey right now.
So why, back a couple of weeks ago, you closed state parks, and people have been arrested for using them. A man was arrested for sitting alone on the beach. Tell me why that poses a danger. And again, on what scientific basis did you make that decision?
Yeah, so Tucker, we were coming into both warm weather and big religious seasons. It was Passover first, then Easter. We've got Ramadan coming up shortly. And certain of the counties were beginning to close their parks. And the concern was that the folks who couldn't go to their normal park would go to another park, another county or a state park. And it wasn't just a gut feel. We then surveilled the state, up and down the state on that first weekend of April when we had some good weather in New Jersey. And in fact, that was just what we saw. Lots of people congregating, lots of out-of-state license plates. So it was a step, trust me, I took no joy in taking that step. But it's one that we felt we had to take. And as I mentioned to a bunch of legislators today, it's not a life sentence.
Okay, but on what basis? What scientific? Because I'm just trying to get to the science here, because I assume all of us are following the lead of epidemiologists. Arresting someone for sitting alone on the beach, tell me how that arrests the spread of the coronavirus from an epidemiological point of view.
Yeah, I wasn't referring to that. I actually don't have the specifics as to why that happened. I meant congregation at state and county parks, of which there was an enormous amount when the weather got warm. And the fact that folks weren't, it's not that they couldn't be in the park and jogging by themselves or walking on their own and keeping distance. They weren't. And there were a lot of out-of-state license plates in the parking lot. And we've got some of the nicest parks in the Northeast, if not the country. Again, it brings me no joy, but we felt that was the right decision to make.
So you made that decision, and as I noted before, 15 congregants at a synagogue in New Jersey were arrested and charged for being in a synagogue together. Now, the Bill of Rights, as you well know, protects Americans' right, enshrines their right to practice their religion as they see fit and to congregate together, to assemble peacefully. By what authority did you nullify the Bill of Rights in issuing this order? How do you have the power to do that?
That's above my pay grade, Tucker. So I wasn't thinking of the Bill of Rights when we did this. We went to first of all, we looked at the data and the science, and it says people have to stay away from each other. That's the best thing we could do to break the back of the curve of this virus that leads to lower hospitalizations and ultimately fatalities.
And I'm not contesting that, though. I think I do think there's a debate. This is a rolling conversation because we're learning new things every day, and nothing is settled at this point.
Understood.
But I do want, since you are an elected official, a leader in the government, an executive, how do you have the authority to order something that so clearly contravenes the Bill of Rights of the United States, the U.S. Constitution? Where do you get the authority to do that?
Well, here's the thing. We know we need to stay away from each other, number one. Number two, we do have broad authority within the state. And number three, we would never do that without coordinating, discussing, and hashing it out with the leaders, the variety of the leaders of the faiths in New Jersey. We are among, if not the most diverse state in America, so we're used to that.
I'm sure that you talk to every rabbi and priest, but there's a deeper question here, and I'm just going to ask you one last time because I think it's important. I'm sure you've thought about this. You can't just, as the governor of a state, tell people who they can talk to when and where, because the Constitution of the United States, upon which all of this is based, prohibits you from doing that. So you clearly decided that you could do it. Did you consult an attorney about this? Did you? I mean, because this is a legal question as well as a medical one, isn't it?
I don't go to the men's room without consulting an attorney, so I guarantee you we did that. But I'll give you an example that was not related to the synagogue. I called up Cardinal Tobin, Cardinal Joe Tobin in Newark. There are 5 or 6 archdioceses in New Jersey. It was coming up to Easter and Holy Week in particular. And I said, listen, I'm really concerned about drive-through Holy Communion, because we had heard some stories about priests who unwittingly had the virus and unwittingly passed it on to parishioners. And he said, we're not doing that, I promise you, and I'll confirm that with my fellow bishops. That's not denying someone their right to worship in any way, that we have to find a different way to worship. And I think that's the point. God bless America.
Yeah, we're not, government's not allowed to tell people how to worship just as a sort of factual matter. Last question, sincere question. So these orders, which, again, I'm presuming and I believe were taken in good faith under trying circumstances, have nevertheless, and you just said it, have resulted in an awful lot of suffering. 577,000 New Jerseyans on unemployment. Doubtless the suicide rate will increase. The addiction rate will increase. Liquor stores are open, as we noted. How much does that weigh on you, that the suffering that this lockdown has caused might equal or perhaps outweigh what the virus does? Do you think about that?
It weighs heavily, and you ask yourself every day, are you making the right decision? And the answer is this. Twofold, Tucker. One is we continue to make every call based on the facts, the data, the science, as best we can. And secondly, I look at what we're doing versus the alternative. And I know that the alternative, had we stepped back and let this virus run amok, 3+ million people in our state would have been infected, and the healthcare system would have had no chance to have kept up with that, and the fatalities would have been multiple. So each life lost is a precious life lost, let there be no doubt about it. But the alternative would have been multiples of this. As it relates to economic suffering, if it had been millions, it would have been a lot worse. It would have been down the road. We chose to rip the Band-Aid off and deal with this up front, and God willing, we've made the right set of decisions.
Best of luck. Governor, thanks for joining us tonight. I appreciate it.
Thanks for having me, Tucker.
That was Governor Phil Murphy of New Jersey on this program just a moment ago. Senator John Kennedy is a Republican, represents the state of Louisiana, another state hit hard by this epidemic. He joins us tonight. Senator, thanks so much for coming on tonight. I just want to say that what I said to the governor of New Jersey, which is I think these are really hard decisions. Nobody is really sure what this disease does because we don't have adequate testing. And so I give everyone the benefit of the doubt. I still, though, am concerned that a governor of a state would say, I didn't consider the Bill of Rights when I issued this order. Are you concerned about that?
Well, I think everybody's concerned, and we should be concerned about that. And Tucker, I have enormous respect for the governor, and I'm not trying to be a smart aleck, but I listened to the whole interview.
I'm not either.
Yeah. He's I know you're not, but I don't understand the governor's points. I mean, here's the way I see it. The American people are not morons. They understand what I'm about to say, and at some point we're going to have to trust them. Number one, very, very soon the can's going to run out of road. We got to open this economy. If we don't, it's going to collapse. And if the U.S. economy collapses, the world economy collapses. And trying to burn down the village to save it is foolish. That's a cold, hard truth. Number two, yes, we shut down, but the shutdown did not stop the spread of the virus. I wish it had, but it's too late for that. The shutdown slowed the spread of the virus at enormous cost, but it still spread. Number three, when we end the shutdown, the virus is going to spread faster. That's just a fact. And the American people understand that. So when we open up, and we're going to have to, and somebody's got to make the call, we've got to be smart about how we do it. Don't open up in the middle of a hot spot. Encourage your elderly and those with pre-existing conditions to stay quarantined and provide them financial support. Wear masks. Try to socially distance. Use technology without violating privacy to try to track the hot spots and track people who have been exposed. Test as much as we can. Make sure that we got health care capacity. Our governors and our president have been building up our health care capacity. But, you know, this is like choosing between cancer and a heart attack. It's a miserable choice. But this much I do know, and I understand. Before we started today, I did some reading on the governor. I'm not being critical, but he's talking about leaving the economy closed until July. Do you really believe the American people are going to stand for that? They're not. They're not. They're going to go back to work. And I sit on the banking committee. I have conference calls twice a week with our senior Federal Reserve officials. This economy is going to collapse. The Federal Reserve cannot buy the economy. And the final point I make, I don't want to hear any more from the sophomoric accusations, and I'm not saying the governor made it, but the sophomoric accusations that if you're morally tainted if you don't want to see the American economy crash. I value life. We all value life in America. So this isn't a question of not valuing life. This is a question of making a hard decision with the cold, hard facts. And anybody who thinks that we can just leave this economy shut down indefinitely until we have no more cases, well, they probably still believe in Bigfoot, because that's just not realistic. And every politician, myself included sometimes, is just dancing around the issue. The American people get it. We got to reopen, and when we do, the coronavirus is going to spread faster, and we got to be ready for it.
You know what kills more people every year than coronavirus? A lot more? Poverty. Poverty kills people in massive numbers. We should remember that. Senator, thank you for those wise words. That was really interesting and thoughtful.
Thank you, Tucker.